Hello, my name is Paul Turner with Main Street Health Group, and I'm working with the Pearland Chamber of Commerce to bring to you a health group cooperative. And so, first I'd like to begin with what is a cooperative. Well, we are a nonprofit organization filed with the Secretary of State. We also have to be filed and approved with the Department of Insurance. Our purpose is banding employers together as one large group to purchase health and related insurance. By related, I mean dental and life insurance, but employee benefits is all that we do. And the long-term goal is to provide stability on rates and plans. We offer multiple plans from multiple carriers and generally provide benefits that large employers have, and we like to make those available to the small groups. Cooperatives act as the employer in all the negotiations with insurance companies and benefit selections, and so therefore we have a large group policy that's issued to the co-op, and we are the administrators of the plan as well. A few clarifying points with health group cooperatives in Texas. We are not funded by the government or the state. We receive no outside funding. It's not an entitlement program. And we are solely supported by our own membership. So the folks like you who join our co-op are the sole supporters of the program. Membership in the co-op requires at least 2 W-2 full-time employees. The company must be based in the state of Texas, and employers who do join the co-op are required by statutes to remain in the co-op for a period of 2 years. We have an annual membership fee, as you can see on the scale, on the sliding scale. Employers with 2 to 10 employees, we start at $150 per year. That's per employer, not per employee. If I might step back, the requirement that an employer join the co-op and remain in the co-op for 2 years provides stability for the group, in that you know that when joining the co-op, along with everyone else, we have a stable group, and that's what helps to provide the stability year over year for the group, particularly when it comes to the rates. We also have a monthly fee, a general administration fee of $20 a month, and then a $1 per employee per month COBRA or state continuation fee. And we'll talk more about that in just a minute. Our plans at this time include 5 PPO plans, ranging from a $500 deductible up to $3,000. We also have 1 HSA plan. We include a group life, which is a flat $25,000 benefit for all employees. And then we have a dental and a supplemental life program as well. In the future, we'll be adding some additional plans as we reach larger numbers. We also have a program called AmeriDoc, which is a 24-hour telemedicine program. This is available for employees that are enrolled in the plan, as well as their dependents that may or may not be enrolled in the plan. So it is available to the whole family unit. And this is a 24-hour program where you can call in and speak with a doctor, and for simple or minor issues, receive a prescription phoned in by the doctor to your local pharmacy. There is no charge to the employee or to the employer for this. This is just an additional benefit and feature of our co-op that we're really very, very pleased with the results so far. Additional benefits, many employers find a great value in some of these. We like to say that we're an extension of your office, basically your benefits department. And we handle all of the questions that any employees may have regarding changes, life status changes, questions on the plan, what it covers, what it doesn't, claim issues as they may come up. So when you have an employee who has a question about the medical plan, we'd like you to steer them to us so we can help them, so that frees up your time. We have, here again, simplified administration. When something comes up, it's just one call to us. We may have several different insurance companies or plans involved, but you only need to contact us, particularly when it comes to a billing question or a termination, new hire, life status change, when these things come up, it's one call and it's easy to us. In return, we send out the billing statements. It's a consolidated statement with all the lines of coverage and a list of all employees on one single form, and it's quite easy to read and to follow. I mentioned COBRA and state continuation earlier. Here we have state laws and federal laws. So an employer with a larger employer, we have to follow the COBRA laws. Smaller employers, 19 or less, we follow the state continuation. So when you have an employee who leaves your place of employment, we send all the packages and notifications to those employees and make them aware of their options. And if they should elect to continue coverage, we will do the billing and collection of those premiums directly from them, so you don't have to. We have a program that we call the Treasury Management Program. We're responsible for collecting all the premiums and then remitting them to the insurance company in a timely manner. So we have our billing system that I had mentioned, which we send out bills on the 23rd of the month, and approximately, depending upon a weekend, and then we collect through ACH collection approximately on the 25th or 6th of the month. And we collect all the premium, and then we send it all to the insurance companies on the 1st or 2nd of the month. And we have to pay 100% in full in advance each month, and we have been doing that for many years now, and this program just works very well for us. So how can you get started? Well, our first step is, we have many steps. The first step is that we ask you to go to our website and complete the employer survey. From there, we will capture your information and then send you an email back with the following items. The employer survey, I have a slide here to show you what it looks like. It's on the information that's been sent out to you. It takes approximately 10 minutes to complete, or less. And then we will send you a follow-up email depending upon the size of your company. But mostly from there, we'll be asking for a census file. Then on smaller employers, we ask for medical questionnaires on employees. This way, when we submit to underwriting for rates, we can provide a very good picture of the population that we have. For larger groups, we can accept 2015 information. After we receive all of this, our next step would be, after we've received all the censuses and medical questionnaires and information from groups, we will submit to underwriting and then come back out with our plans and rates, our proposed plans and rates, and then we will begin open enrollment. And hopefully we will have the same amount of people who we turned in for underwriting also enroll in the plan. If so, our plan will become effective with those rates on January the 1st of 2013. Our goal is to build a group up of at least 500 employees. We're well on our way to that and hope that you will be a part of it. This is a slide of what our employer survey looks like, so when you see this, you'll recognize it. And as I said, it should only take less than 10 minutes to complete this. The pricing of our group, the way that the rates will be determined, of course, is the size. If we hit our 500 lives, our target goal, we feel that we can provide very competitive rates. There again, the other factors that go into this is the mix of age and gender mix. And hopefully we have a fairly balanced population there. And then the health conditions of the group. And so just to wrap things up, in Main Street Health Group, we offer large group medical plans. Our goal is to band together many employers into the program for stability and more competitive rates than you might have on your own. Many employers see us as a great benefit, as outsourcing a lot of the issues that they have to deal with when it comes to medical and dental and life plans and the questions and challenges that come with that. And then they appreciate our consolidated billing and then the reduction in the administrative time that they have to apply to these programs, and then the relief of the COBRA and state continuation. Thank you very much. If you have any questions, please feel free to contact me on the information that's been supplied. Thank you.